actually a bacterial infection, and what it does is it affects the gum around the tooth, and once it gets down into the gum, it loosens the gum up, and then it gets to the bone, and the bone actually gets dissolved away. So that's the big problem, is that you get bone loss, and this is a slowly progressive disease, so a lot of times there's not a lot of symptoms. If you have symptoms, if you have loose teeth, it's probably progressed a little bit further. The other thing that causes gum disease is the bite being off, the way the teeth fit together. If that is off, if your bite is heavy on a certain spot, it can cause a lot of damage to the tooth and can cause the gum to pull away, which we call recession, or it can cause deep pockets, which is again the infection around the bone. So those are the two main causes: bacteria and the bite. If you see blood when you're rinsing your mouth after you've brushed or when you're flossing, that's definitely a sign of gum disease, because bleeding means that there's infection, and that's one of the signs that we see is bleeding gums. The best way to know if you have gum disease is to actually be checked by a dental professional. What we do is we examine the mouth, we look for recession, we look for pockets. You actually have to use a little measuring tool to measure around the gum line, and that tells us if you have deep pockets or not, or if you have bleeding. Your gums should not bleed. Bleeding is a sign of infection. So also we need to take x-rays, and the x-rays will show what the bone looks like, what the root looks like, and that gives us a good idea of the extent of the problem that you may have. Gum disease is being linked to a lot of systemic diseases, such as heart attacks and strokes and diabetes, and even causing problems in pregnancy. And the reason why is because this is a bacteria. So the bacteria gets down under the gum line and it gets into the bone and the gums have a lot of blood vessels. So these bacteria actually get into the blood vessels, which means it goes through the body and it's getting in all of your organs that you have. So that's the link, is infection. It's infection which causes problems in other areas of the body.